there, everyone, and welcome to week 3. This week, we are going to be talking about some of the guiding principles for community health work, as well as working with clients. These topics correlate with chapters 7, 8, and 9. This week's online assignments include there is an ethics case study, there will be a quiz on the scope of practice, discussion board, and your reflection journal. For the ethics case studies, the purpose of it is to apply some ethical considerations for potential CHW interactions, and also to identify professional boundaries and situations where boundary setting may be needed. On page 158 in your textbook is the list of the CHW Code of Ethics. And I just wanted to show you the assignment really quick so you're familiar with what it looks like. So here's what the assignment will look like. And so what I've provided are 5 scenarios that are things that could happen when you are working as a community health worker. What I'd like you to do is read each scenario and then answer what you should do. All right, back to our PowerPoint. The objectives for this week online are to be able to apply ethical considerations to potential CHW interactions, to define the CHW scope of sequence and identify services that usually lie within and outside of the scope of sequence or scope of practice, describe client-centered practice and strength-based approach, and then finally identify strategies in conducting your initial interview with a client. When we think about ethical standards, these are ideas that provide guidance for professionals regarding how to behave with clients. It helps standardize behavior, and they're influenced by your own values. And a value is a belief and attitude about what matters in life. Some of the CHW core values include honesty, respect, integrity, which is doing the right thing in a reliable way, open-mindedness, self-determination, acceptance, trust, and tolerance. So again, I want you to review the Code of Ethics that you will find on page 158 in your textbook. Some of the key terms as it relates to Code of Ethics are informed consent. And this is your obligation to provide a client with the information they need to make a good decision. And it's a free and informed decision. And by free, I mean they are free to make whatever decision they feel is best. There's no coercion or threats or anything like that. And informed that they are adequately informed on what they are consenting to. And the second key term is confidentiality. And this is that you must protect your client's communication. You will not disclose your client's information to others outside of your supervisor. There is an exception though. That exception is if a client says they want to harm themselves or others, so they're at risk, the CHW then has an ethical obligation that requires you to report the harm or threat of harm to protect the health and safety of the victim or potential victim. In cases of mandated reporting, you have to involve the client to help maintain a positive relationship. And if you are unsure, ask your supervisor. I see there's a typo over there. But it's important to talk to your supervisor about what to do. Mandated reporting is that if the child is in danger or you feel they may be in danger, you are required by law to report it. When we think about the scope of practice, it's again a term used to determine which skills and services workers are competent and authorized to perform on the job. In addition, it also defines what services and skills are outside of the job functions. So an example is doctors are trained to diagnose illnesses, so that is obviously within the scope of practice. However, doctors are not trained to provide legal advice, so that would be outside the scope of practice. When we look at tasks and services within the CHW scope of practice, they include recruitment of clients, conducting initial interviews with new clients, supporting clients to access new services, helping clients better understand their own questions, resources, knowledge, and options for actions and services, supporting clients in communicating their questions and/or concerns, providing culturally and linguistically appropriate health education and information, helping support clients to develop and implement a plan to reduce risk and to enhance their health, to support clients in behavior change, to provide coaching services. This is also called peer counseling, and to provide some case management, although there is some challenge on that term if case management is an appropriate service for community health workers. Tasks and services that are outside the CHW scope of practice include diagnosing illnesses and other health conditions, prescribing treatment or medication, counseling severely ill clients, but within that you are allowed to provide outreach, peer support, health education, and case management, providing therapy, and providing advice on legal or medical issues. Those are all definitely outside the scope of practice. But sometimes there are services that may fall within or outside the scope of practice, and usually these are determined by your agency of employment. So you will have to look at what they are employing you for and the services they provide. And so you can see here what it entails. And again, this is going to be dependent on the job that you are performing. So what to do if you are uncertain about your scope of practice? One thing you could do is review your job description and your agency's policies. If you're still uncertain, don't do it. Consult with your supervisor first. Examine the potential for causing harm. Clearly explain to the client the services you can and cannot perform. And when questions arise, always ask your supervisor first. The next principle I'd like to talk about is this idea of client-centered practice. It's a principle used to guide the community health worker services. And the emphasis really is on the client. And so you're looking at the client's experiences, ideas, beliefs, and feelings. You're working in a way that enhances the client's autonomy or freedom or independence to choose on their own. You are not telling them what to do. You are not providing advice. You are helping them guide their own thoughts. And so the guiding principle behind client-centered practice is, in order for change to be most valuable and effective, it has to come from the client. It cannot come from you. Just think that nobody likes to be told what to do, what they're doing wrong, and what they need to change. So keep that in the back of your mind as you talk to clients. Again, so it's not the role of the CHW to tell clients what to believe, what to do. The role is to support the client by analyzing the factors that both harm and promote their health, identify choices or courses of action and their consequences, and help them develop and implement a plan. This concludes our PowerPoint for week 3, our online PowerPoint. Have a wonderful week.